Good morning. I'm attorney Ben Crump, and along with attorney Kayla Onder of the Onder Law Firm, we have the honor of representing Mallory Meeks, who's present with us today, and many other sexual assault survivors we believe were intentionally preyed upon by a sexual predator on the campus of SSM Health Facilities. At this time, Attorney Onder is going to address you first to talk about the substance and the context of the lawsuit that we filed this morning to hold this sexual predator accountable. And then I will talk about different aspects after learning from Mallory and some of the other victims, their perspective, and finally you'll hear from Mallory, who is a voice for so many others who have not yet found the courage to come forward publicly and talk about the abuse that they sustained. And then after that, we will allow your questions and we'll try to answer them as much as we can. So I give you attorney Kayla Onder.
Good morning, everyone. I'm Kayla Onder with the Onder Law Firm. Again, like Attorney Crump stated, we filed our case this morning in St. Louis County. This case has been filed against Dr. Craig Spiegel and SSM Health. Dr. Spiegel was abusing women and children under the guise of medical treatment. SSM was aware and they did nothing. We are here today not only to demand accountability, but we also seek systemic change. The 30 brave people we represent were not only victimized by someone they should have been able to trust, their doctor, but by institutional indifference. You will hear from our survivor today. Others are not ready to tell their story publicly, and quite frankly, some of the details we can't say on broadcast television. Those acts were allowed to continue week after week, month after month, year after year, victim after victim, and SSM Health turned a blind eye. Our survivors had every reason to feel safe at SSM Health's campus, and they were let down. The allegations that are filing show that this was not a single lapse of judgment. This was a systemic failure. Repeated failures to act on warnings, ignored red flags, and a conscious choice to put convenience above patient safety. As a mandatory reporter under the law, by their own policies and procedures, and by a moral obligation, SSM is required to ensure a safe environment. And they failed on all fronts. They failed young children, they failed women, and they failed the families that trusted them and put their faith in SSM healthcare system. They were all betrayed. Let this case serve as a warning. A policy on paper is not anything if it's not enforced. Reporting mechanisms are useless if they are ignored. This horrific case must drive institutional change. Victims of sexual abuse are also often silenced by fear, by shame, or by the weight of institutional power. Our clients have chosen to step into the light, to fight for themselves and for the others who cannot. It is a testament to their bravery. Let this be a declaration that their voices matter and they will be heard.
Do you anticipate more victims coming forward?
We do. And if
We'll get the questions.
Yes.
We'll get the questions
Okay,
after.
okay.
Yeah. This is very personal to Kayla and myself based on our life experiences. Many of the people who were preyed upon by Dr. Spiegel were poor people of color. And it is a known fact that sexual assault is often masked by the race of the victim, sometimes by the zip code where the victim lives, the financial resources of the victim. I mean, it's still shocking that you had people go and try to report Dr. Spiegel and they were not taken seriously. It begs the question if he were these were white women making these reports, would they have been taken more seriously? I mean, it is unacceptable that you try to marginalize them even more when they finally get the courage to come and say, my doctor is touching me inappropriately. He's making me do things inappropriately. And you tell them, oh, well, that's not our concern. But he's on your campus. They go to SSM's facility and they're saying, well, he's a doctor here. He's supposed to be somebody we can trust. He's betrayed that trust, as Kayla said, and now I'm reporting him. I'm trying to do the right thing. And you're telling me, no, we won't help you either. You wanted help from the doctor, he betrayed you, and now we're going to try to suppress your coming to speak truth. That's why this is very personal on many levels. Obviously, the criminal charges are going forward, but there are so many more people who have come to Kayla and I who just feel that the system don't protect people like them when they're poor women of color. And that's what this case is about. And that's why we're so proud of Mallory and those who have retained us to say that they're not going to suffer in silence no more. They will be victims no more. They will speak up and they will stop their abuse. And so we ask anybody out there who believe that they have been a victim and preyed upon. The reason we say sexual predator, we're listening to our clients and they talk about, why is my pediatric doctor still treating me at 25 and 30? And it's because the socioeconomic levels that they're having problems getting help. But then he is continuing to say, I can treat you for everything. Just come to me. You don't have to go to anybody else. And so you hear these stories over and over and you're just shaking your head like, why didn't anybody stop this? All these people coming forward and nobody put a stop to it. And so that's why Kayla and I are saying we will help them be heard and they won't have to suffer in silence anymore. And so at this time you will hear from Mallory, who will tell her story, and then we'll try to answer all your questions.
Ms. Onder, would you stand close to her so we can pick her up from your microphone? Would that be okay?
You want you to come on this side, Nyla. There you go. And talk as loud as you can.
Good morning. My name is Mallory, and I'm a survivor. I am the voice for those who are afraid to come forward due to what others may think. I am the voice for those who are ashamed of what has happened to them. I am the voice for those who may not even understand what has happened to them. I am the voice for those who have been silenced. And I am the voice for those who are no longer here to speak their truth. Mental, physical, emotional, and sexual abuse is real, and it happens all around us, every day even, to our men, our women, and even our precious children. But I am here to make light that you are not alone. It's okay to speak your truth and come forward no matter how big or small you think it may be. What you endured, sorry, I'm so sorry.
Take your time.
Okay. What you endured is important and shouldn't be brushed under the rug. Abusers should be held accountable for their actions, and it starts with us. Thank you.
Thank you so much, Mallory. At this time, we'll try to take your questions. Kayla and I may answer most of them, and if Mallory can, she will try to answer. I'm sorry. Sir, you had a question that early?
If you wouldn't mind telling me whether you think you're going to have more people come forward. Is this just the beginning?
I think this is just the beginning. Right now, we have just over 30 survivors. He's been practicing for a very long time. We know that others are out there. Again, like Mallory said, some don't even know they were sexually abused. They've been seeing him since they were a child. They may have not seen anyone else, so they don't know, was this right? Was this wrong? So we do anticipate more coming forward, and we welcome that.
SSM releasing a statement saying that this did not happen on their property, that he was not an employee of SSM Health, that they put the finger to a third-party Ventas company. Do you have any response to that?
Yeah, I have heard those arguments. We do know that he had staff privileges. For anyone who's been to SSM, when you pull up to the campus, you recognize it as the SSM building. Just because there's a doctor in a medical facility within their campus, are we going to put it on the victims to understand private real estate contracts and whose office is what? They pulled up to the building, they saw SSM's name, and they trusted that he was affiliated and he was a reputable doctor because of what they put out.
Mr. Crump, you said that you feel that these practices are targeting people of low income, people of color. Of the 30 people that you're representing, how many of them are people of color?
The majority are, and it's not surprising to me because people normally try to use their power to abuse people they think they can get away with it on. And sexual assault is about power. And he's preying on those who are most vulnerable in our society. And what's even worse, when they reported it to SSM Health, you just have to read the complaint and hit a response. Well, he doesn't work for us. You're a mandatory reporter. People are saying we believe children are being sexually abused, and you look the other way. You're supposed to be a pillar in the community. You're supposed to be a foundation that people trust. You cannot turn a blind eye. I don't care if they're black, brown, or white. You should take it seriously when somebody says, we believe the doctor is abusing sexually children, abusing women. It's a serious matter.
Amongst the 30 clients that you guys have, how many of them say that they were abused when they were children?
A great majority, I'd say well over half. Again, he's a pediatrician here in St. Louis. So, there was grooming going on. He saw them since they were young children. Oftentimes when you see a pediatrician, once you're no longer a child, you go on to another doctor. And like Ben Crump said, he continued to see patients. He said, I can treat you for everything. He saw them in their 20s, 30s. I think our oldest client is in her 40s. And I anticipate there will be older ones as well. So, yeah.
It's my understanding that back in March, there was a criminal case that started. He did not turn over his license. Do we know, has he done that in the time since? Is he still seeing any patients? Do we know where he's at?
My understanding is he's not currently seeing patients, but we're not able to speak on the criminal trial. This is the civil trial. We're going after it differently, so we're not able to speak on the criminal trial.
And what is the difference in approach?
The difference in approach, the criminal system is meant to, to punish and to put people away. The civil system is meant to have change, and that's what we're asking for. We're asking for accountability. We're asking for systemic change. We're asking for these institutions to recognize that they have a responsibility as pillars in the community, and that's what we're asking for.
And I will say this, to add to what Attorney Onder just said, we have to remember the 7th Amendment is there for a reason, to hold all of those accountable who have committed wrongs. The criminal system is going to deal with Dr. Spiegel. The civil system has to speak to SSM's conduct and everybody else who were accomplices in allowing this to go on for so many years. If this was your child, wouldn't you want everybody held accountable? Well, that's what Attorney Onder and I seek to do in this civil lawsuit that was filed this morning, to hold everybody accountable and to make sure that these victims know that when they finally find their voice to say, this is wrong, Dr. Spiegel, I'm going to report you to SSM Health, that SSM Health won't try to sweep their complaint under the rug either.
I would just want to say thank you for taking the time to share your experience. I'm not going to ask you for what exactly happened, but can you talk about what Dr. Spiegel took from you?
My childhood. He changed the way I looked at healthcare, at doctors. It was a fine line between what was allowable and what was too much. So I'm cautious about my providers and who I choose to see and who I run to for help.
What would you say to other victims that are on the fence about potentially coming forward?
Once again, you are not alone. You are not. Everybody needs to be held accountable. So please, if anything happened, please come forward.
Yeah, and I would acknowledge Mallory is very brave to be here today. There were others who were supposed to be here for reasons did not come, and that's something that Kayla and I see often. Sexual abuse victims, they tend to blame themselves and say, well, it's my fault, I shouldn't have let it happen to me. No, they are not at fault. Dr. Spiegel, the people who assault victims, who prey on people, are the people at fault. And this has to be condemned. It can't be condoned, SSM Health. It has to be condemned.